Drowsy driving is to blame for 1.2 million collisions a year and up to 8,000 deaths, rather.
Tonight, researchers say some of those crashes could be prevented by treating some high-risk drivers. Our Dr. Frank McGeorge is here to explain.
One of the causes of drowsy driving is a problem called sleep apnea. It causes the upper airway to collapse frequently during sleep, interrupting breathing and robbing people of a good night's rest. Now, a new study suggests targeting that problem could make a lot of people more alert on the road.
Staying awake at the wheel can be a challenge for the 25 million Americans who suffer from sleep apnea. New research from the Cleveland Clinic finds treating the condition with a CPAP machine does reduce the risk.
There was a significant reduction in the drowsy driving episodes, and this reduction was more pronounced in patients who were CPAP adherent. This is a very important finding because drowsy driving poses a very important public health risk.
CPAP stands for continuous positive airway pressure. The device increases airway pressure in the throat during sleep to prevent the airway from collapsing. Researchers analyzed questionnaires from nearly 2,000 people with sleep apnea before and after they started using CPAP. Those who used it regularly saw the greatest reduction in accidents and near misses. Left untreated, sleep apnea also raises the risk of cardiovascular problems, high blood pressure, diabetes, and workplace accidents.
If you think you have obstructive sleep apnea or you have signs and symptoms of obstructive sleep apnea, such as loud snoring, having pauses in breathing, or you feel excessively tired or sleepy during the day, please seek medical attention.
Now, obviously, truck drivers with undiagnosed or untreated sleep apnea also pose a big risk, and they may soon face more screening for the condition. The Supreme Court recently decided not to hear a case from a driver who claimed his employer violated his rights by requiring him to be tested. Back to you.
Experts warn drowsy driving is also a problem parents need to watch for in teenagers. Drivers under the age of 24 are twice as likely to fall asleep at the wheel compared to 40 to 59-year-olds.